Welcome to the video version of the Reviving Vet Med podcast. Sometimes, even with the best of intentions, the way we communicate can create harm. Small comments, assumptions, or interactions that may seem insignificant in the moment can have a cumulative effect on how people experience belonging, respect, and inclusion. My guest today is Dr. Naomi Nishi, who has a PhD and is a scholar-practitioner, educator, and Associate Dean of Culture, Community, and Accessible Care at Colorado State University's College of Veterinary Medicine and Biomedical Sciences. Naomi's research focuses on intersectional equity and social and health justice in higher education and STEM education. And she is the co-author of the paper Microaggressions in Veterinary Communication. What are they? How are they harmful? And what can veterinary professionals and educators do? There's a lot I appreciate about Naomi's perspective, especially the way she frames microaggressions as a communication and trust issue. Because the micro in microaggressions does not mean the impact is small, and understanding these interactions gives us an opportunity to strengthen the relationships at the heart of veterinary medicine. In this conversation, we talk about what microaggressions are, how they show up in veterinary settings, and why intent and impact can sometimes be different. Naomi also shares practical strategies for responding when we recognize we've caused harm and for creating veterinary environments where clients, colleagues, and learners feel respected and valued. So let's get into it. Here's my conversation with Dr. Naomi Nishi. Okay, hi, Naomi. Thank you so much for joining me on the podcast today. It's great to have you.
Glad to be with you. I'm excited.
Yeah, me too. This is such an important conversation that we're about to have. And of course, a lot of our conversation dovetails off of your paper that you published and that I recently read and then reread again. And you begin by highlighting the fact that microaggressions are often misunderstood, especially because many are unintentional. And I was hoping that you could start by defining what a microaggression is and what makes it different from simply making a mistake or having an awkward interaction with someone.
Thank you for this question. I'd love to draw on another scholar's definition because it is my favorite one, and I promise that this will be the only thing I'm reading to you today, but I did write it down to make sure I was saying it. This comes from Gerald Wing Su, who is a scholar in social work and colleagues from a 2007 article. And they describe microaggressions as brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative, degrading slights and insults toward people with marginalized identities. So to break that down a little bit more, beyond what Sue and colleagues share with us, there's three main points that I think folks have to understand about microaggressions. The first is that they are in mass, they are compiled. So when we talk about microaggressions, we're never talking about one microaggression. We're talking about the latest microaggression, or we're talking about a lifetime of experiencing microaggressions. Um, I have colleagues and students who will come to me and share experiences that they've had with microaggressions. And I've never had anyone who was like, this is the first time I experienced this. It's always the latest, the straw that broke the camel's back. And usually they're not even hoping for help for themselves. They want to see change so it doesn't happen to the next person who looks or shares identities that they have. The other important thing to remember is that, and you said this already, Marie, they are defined by the impact, not the intent. And we'll get into this a little bit more, but so often when people are starting to understand microaggressions, that's one of the biggest things we hear is like, well, I didn't mean it like that, or I wasn't intending to harm them. And intentions are important, but when it comes to microaggressions, the intent rarely has an impact on the impact. you can intend whatever you want, but how it's received and how it harms the other person is really what we're focused on when we're talking about microaggressions. And then the third thing that can be tricky for folks to get their heads around is microaggressions are unique in the way that they work to reinforce negative stereotypes about people with marginalized identities. Now, we can describe and get into what are these marginalized identities, but some of the examples are people of color, LGBTQIA plus folks, disabled folks, and we could go on, women, and list all of these different marginalized identities who can experience microaggressions when they are reinforcing stereotypes, negative stereotypes against those groups. Now, I do like to say, and then I'll stop and let you share more, but I do like to share with people that when we're talking about microaggressions, we're not saying it's okay to say offensive things to folks with dominant identities. That's not what we're saying. What we're saying is there is a unique harm done when we use microaggressions and reinforce these negative stereotypes against marginalized communities that they are experiencing and hearing and having reinforced in all these different ways every day of their life. So there is a unique difference. And so, yes, we should be kind to everybody and we shouldn't say offensive things to anybody, but we also should understand that there's a unique harm done when we reinforce those negative stereotypes against marginalized communities.
Absolutely. Yeah, I agree with you. We're always talking about this in our household. You know, it's important to be kind, and it's also important to recognize the different experiences of others and how, um, the things that we say can really have a deep impact. And I love that emphasis on the intention does not take away the impact, no matter how well intended a person was. One of the things I was hoping you could clarify as well is, the term microaggression has the word micro in it, and we feel like
Mm,
that's small, right?
yeah.
And so one person might perceive that these are just little things. Could you clarify why that's not the case when it comes to impact?
Yeah, it's a great question, and it's also something that has been debated amongst scholars in the literature who study microaggressions. You might be familiar with Ibrahim X. Kendi. He's written several books. He's advocated for moving away from the term microaggressions, but other scholars, particularly critical race scholars, tend to say, no, this was a concept. It was a concept developed by psychologist Chester Pierce, a Black man who recognized a phenomenon happening with his patients who were largely Black men. Um, and he coined that term microaggressions to really get at the very real harm that he was seeing his patients come in with that came from several of these slights, or I love the word indignities that Daryl Wing Sue uses instead of slights. But to go back to your point, the reason that there's been this debate is particularly folks who do not experience microaggressions, when they hear the term, they think it is measuring the size of it. I have an article that I published several years ago called It's Only Micro If You Don't Experience It. And I think that kind of got into the flipping the sense of it. Like it might seem micro to those of us who are wielding a microaggression. We say something and it seemed little to us, but to the person who then is internalizing it or experiencing real harm from it, it does not feel small. And so we do need to kind of hold on to that. I don't advocate for changing the name microaggressions, but I do think we have to be extra diligent to remind folks. And that's why the remembering that it is in mass, these are compiled, is important to remember. Because if it's just a little comment, then particularly of us who don't experience them as harm, can brush it off and say, "Well, I just don't know why you can't get over this because it was over. It was so little," and not paying attention to Gerald Wing Sue and others have called microaggressions death by 1,000 paper cuts. So the paper cut might feel little, but it's on an already festering wound if we want to take the metaphor a little further.
Yeah, because these are emphasizing, systemic issues like systemic discrimination and everything else, right? So
Yeah.
that's henceforth why it feels so impactful, despite it being just one interaction from that one individual, on top
Yeah.
of, as you are saying, a series of interactions over a series of years and a lifetime, really, for many folks.
Hmm.
I think in vet medicine, we really see ourselves as caring people, right? We consider ourselves compassionate, and caring professionals. And so I think that it's hard for some individuals to hold space for the fact that good intentions and harmful impacts can exist at the same time.
Yeah.
Can you provide some context as to why it is so important to hold space for that impact
Mm.
and recognize that even the best of us, myself included, can can say things that we of course don't intend to harm anybody and yet not recognize because of our unconscious biases that they are indeed harmful to others.
Yep. Yep. It's such an important question. Um, One thing I like to remind people and share with people is that we all end up committing microaggressions or wielding microaggressions that we don't mean to. I've been studying this and doing research on microaggressions for quite a while now, and I still microaggress. And we'll talk a little bit about what do we do in those moments when somebody shares with us that we've harmed them in that way. And so it's natural to feel defensive. I have held DEI positions, so I am very humbled the moment somebody comes to me and they're like, "Hey, Naomi, you said this, it was harmful." But I have to get good at practicing, like, I want to do better, and this is a lifelong journey where I never reach a destination. I just continue doing the work. And so I think that can be helpful for folks to hear, to know, like, especially with so many veterinarians, y'all are so brilliant and tend to have a lot of perfectionism. And you're like, no, I want to do this perfectly. And the bad news is you can't ever do this perfectly. The good news is that none of us can, but we can just keep on doing the work. I also like to remind folks that because we all microaggress, it doesn't mean we're bad people or we don't care. And I think sometimes we take it that far when we realize we've harmed somebody, especially veterinarians who dedicate their lives to helping people and their animals. Um, it can be a real blow to realize something you said or did was harmful to a person. Um, and so I also encourage folks to try to move away from shame and blame related to microaggressions, but instead allow ourselves to take responsibility and accountability even when we didn't mean it. So saying, like, okay, I didn't mean to hurt Marie. I didn't mean to hurt this person, but I did anyway. And I can be accountable for that, and I can learn from that, and I can share with her I'm sorry and that I'm going to do better in the future. So I think when we start to hold those things, it doesn't mean the defensiveness or feeling bad about it goes away, but we start to say, this is part of the process of me learning. I won't make that microaggression again to that person. Like, I've learned something, I've learned a way of um, sharing and being in spaces that I can grow from. And I think if we can kind of realign it that way, that's how we can kind of get past the, but I didn't mean it like that. Because you didn't. but it
I have
didn't
so
matter.
many. Absolutely. I have so many comments or things that pop up for me in response to that. It's that two things can be true at once, right? We can have good intentions and we can still harm others, and we can make mistakes and we can still be in the process of learning and growing. And I always joke with people in the well-being space, I'm a constant work in progress. There's no end point, right? We're constantly
Yep,
learning and
me too.
growing and evolving, and I think just maintaining that mindset is really important.
Yeah.
I would love to dig into your research, Naomi, because you talk a lot about microaggressions in veterinary medicine, and I'd love to talk about them in the context of clients.
Mhm.
There are situations where we as veterinary professionals might make assumptions about a client's socioeconomic status, which therefore in indicates their ability to pay or not pay, what their
Yeah.
competence is, or their commitment even to their animal's care. And I would love if you could share some examples of how our unconscious bias can influence how we communicate with our clients, how we make clinical decisions, and how those moments can really have a deep impact on the trust relationship between the client and the veterinary team.
Yeah, absolutely. It's such an important question. Um, the first thing I'll say, and I share this with our colleagues and with our students, is that we know how important trust is between a client and their veterinary provider. And we can also gain from research and what we've seen in human medicine as well when it comes to that trust relationship between provider and patient and or client, given the context. We know a couple of things. We know in both veterinary medicine and human medicine that if a person does not trust their provider, they are less likely to follow through on what that provider has recommended or prescribed for them or their animal. We also know they're more likely to go find another provider who they can build trust with. And we know that there are a lot of places that there is a dearth of veterinary professionals. And so, in some cases, people will go without care if they do not trust their veterinary provider. So, it has very deep implications. And microaggressions are a surefire way to break that trust. If somebody thinks, well, gosh, you're making a lot of assumptions about me, or I'm feeling like you're making a lot of assumptions about me, and you made this little comment about where I'm from, or or my background, or something like that you don't know anything about, I'm not sure now I trust you to give me the best advice. Like you're going to be making, and we see that this happens. We see it in our veterinary hospital as well, where some of our providers do make assumptions, and those assumptions also affect what they do prescribe or what they do recommend for that animal. So it can work on both sides, whether it's the client saying like, I'm just not sure I trust them to provide the best care for my animal, or the veterinary provider or the veterinarian is saying like, oh, I'm gonna leave this option off the table, or I'm gonna steer them in this way because I think that this is true about the person. And again, I don't think any veterinarians or providers are doing that intentionally. I do believe that veterinarians always have animals' best interest at heart. But as you mentioned, if you have biases that you have not explored and you have not actively worked to dismantle, those creep up, especially in moments where you are making fast choices, which y'all as veterinarians are a busy bunch. And you're going from thing to thing to thing, and you have to make snap decisions all the time. And that's when we are most vulnerable to those biases coming up because our brain's trying to help us make those shortcuts. And if we have unchecked assumptions, those are quick shortcuts that we're used to making. So I'll pause there. I don't know that I caught all of the pieces of your question, but those are some examples in the way that we see it play out in clinical spaces.
Yeah, that was perfect. I mean, it's really just honing in on the fact that when we have these unconscious biases, and I guess it's not when, it's we all have them,
Yeah,
right?
we
And
do.
I have been fascinated in doing some exercises to explore my own unconscious
Mm,
biases, and it really is illuminating when you see the shortcuts or the assumptions or the tendencies that your brain goes without you even
yeah,
recognizing it. And so it makes sense
yeah,
then that in intense situations or time sensitive situations that we would, as you said, make these shortcuts, right? Make these assumptions and end up jumping to conclusions essentially, which may mean offering care that we think they will want to do without giving them all
yeah,
the options or while leaving some things off of the table. So
yeah.
that's, you highlighted that perfectly. It's, I think it's so important to emphasize what you said earlier, which is that this trust relationship between clients and the team is so very important. And I think about that in my own experiences. I am a
Mm,
veterinarian, but I'm also a pet owner. And so I can think of times when I've taken my dog to a practitioner that I just didn't
mm,
quite have that sense that, yeah, that they were offering me all of the different options or the options that I was
mm,
interested in pursuing. And so you're right, it makes you
mm,
want to seek care elsewhere. And it
mhm.
would make sense that this would happen in other healthcare providing spaces like human medicine as well. I'm wondering when a client experiences a microaggression, whether it's from a veterinarian, a technician, a receptionist, or just the broader hospital environment as a whole, what do you think is happening psychologically that will impact that relationship in the future?
Yeah, that is another important question. So we know from the literature that when somebody experiences a microaggression, especially folks who have multiple marginalized identities, folks who have certain marginalized identities. I'm thinking particularly of Black clients who have a long lifetime of experiencing racial microaggressions. One thing that the literature has borne out, and this also came from Chester Pierce and then his sort of mentees who followed that line through. So Smith and Hung have a really important article on racial battle fatigue, talking about the physiological effects of things like microaggressions and that battle fatigue. And I think it bears out to other populations too. If you are experiencing a lifetime of microaggressions and all these little sites that are like, you're a little less than, because they're dehumanizing, right? You're a little less than human, you're a little less than us. Um, when those messages are constantly given to a person, it does show up in stress responses. It does show up in sometimes trauma responses. So those things can all be invoked. Beyond that, we see things like folks with marginalized identities who may be dealing with imposter phenomenon, that's reinforced again. So then they're internalizing that. So in all the ways we can think of, microaggressions harm people mentally, physiologically, emotionally, etc. And so when they experience that, in most instances, people will go find somebody else because they're trying to self-protect. Like, I can't trust that I'm not going to experience that again. And we can talk a little bit more about this, but one thing we see is if folks who experience microaggressions a lot raise it with a certain person, oftentimes in that conversation, because that person becomes defensive, they experience more microaggressions as a result. So, micro invalidations. Like, I think you're just being overly sensitive. Like, why are you making everything about race or gender or ability or whatever it might be? And those are also microaggressions because you're now invalidating, like, I'm not worried about your experience. I'm worried about my intentions. And we center ourselves in those moments instead of saying, like, wow, I'm so sorry that I harmed you in that way. So these are ways that they have very real impacts in all the ways that we can think about.
Yeah, I'm just thinking back to books that I've read and experiences that I've had, and yes, you feel like you have to comfort the other person, right? When a person is microaggressed and the microaggressor becomes defensive or acts very distressed, right? That, oh, I can't believe I said
Mhm.
that. I feel so bad.
Mhm.
And it gets to be this long drawn out thing that,
Mhm.
yeah, the focus is centered on them rather than the person who was harmed. We've
Mhm.
we've talked a lot about microaggression in the veterinary client relationship. I want to talk about
Mhm.
it a little bit within the team, the veterinary
Mhm.
team. And I think that, of course, this can happen within this dynamic as well. And I'm wondering if you could describe or paint a picture for how this might show up in the veterinary workplace among colleagues and what impact that will have, especially when it comes to that sense of belonging, which we know is so important for retention and well-being in vet medicine.
Yeah. 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 Thanks for this question. Um, we see the impacts on the person similar to what we see happening. So all of these things I'm describing that clients might experience, team members with marginalized identities will experience similar things. But there are some differences. It for sure has an impact on how productive a team can be. Because if you do not have trust within a team, that's an ongoing relationship, even more than provider and client would be. So, some of the ways that this shows up that I've seen is you'll have team members who are from certain communities of color, who, particularly Black and Brown team members, who are labeled or told that they're being too aggressive. And that is, again, reaffirming this negative stereotype of Black and Brown people that they're aggressive or violent or whatever it might be. So there, a lot of tone policing can show up in these team settings, where not only are we telling our colleagues of color, like, you have to, I don't care about what you're experiencing, and I also expect you to not say anything about it. I expect you to keep quiet. Otherwise, you're not a team player. Like the moment you're raising concerns about how you're being treated and what your experience is, that can be isolating. And some of my research has showed that in teams or in groups, when somebody is experiencing microaggression, they will do some self-isolating from the group. So they're like trying again to self-protect, like how do I remove myself as much as possible from this experience, this situation, this team that is hurting me. We've all heard of toxic workplaces. I think oftentimes we miss how microaggressions have a huge part in creating toxic climates for everybody, because even these marginalized identities, they tend to overlap. Like it's very hard to clearly separate different systems of oppression from one another, particularly for folks who have multiple marginalized identities. It's like, was that racism or sexism, or was that genderism? I like, it's hard to separate it all because they're just experiencing it as a dehumanizing process. So those are some of the things we've seen. Another example that I've seen within veterinary teams is related to some of our neurodivergent colleagues who their social cues are misinterpreted by neurotypical colleagues. So they're told, like, gosh, it seems like you don't want to be here because you're never looking at me in the eyes and you're never asking questions. And so I just don't even think you want to be here. Instead of thinking like, this person's social cues I'm interpreting them differently than they are intended. Like, how do I make sure that I'm communicating with my colleagues and not making all these assumptions about, again, they don't want to be a team player, and I'm deciding they don't because I notice things like eye contact, or I notice things like them staying quiet in situations where I would expect them to jump in.
Oh, it's so helpful. And thank you for all of those examples. And yes, there's so many different ways that this can show up in the veterinary workplace. And I'm so glad that we're having this conversation because I think that many individuals just won't have even thought about that. And I think back to my time on faculty at the Ontario Vet College when we would be grading
Mm.
students that would come through the ICU rotation. And yes, making assumptions about their comprehension or their knowledge based on the fact that they were quiet or
Mhm.
shy or whatever it might be.
Mhm.
That was years ago before we were really having more conversations about neurodiversity and obviously overlooking the fact that that may just be the way an individual's brain is perceiving information and processing emotion or demonstrating emotion. So I love that you brought that up as well.
Mhm.
I think the difficult moment for many people is when they've been told that they've said or done something that landed differently than they intended. And as we mentioned earlier, our instinct can be to defend ourselves. That's
Mhm.
not what I meant. What does a healthier response look like when someone points out that we have microaggressed? What are some strategies that we can use to move away from defensiveness, towards maybe curiosity and hopefully
Mhm.
accountability?
Love that. Yeah, so I advocate for scripting it out. And I use a script myself because the script reminds me of what I want to say, and I don't let feelings of defensiveness or frustration take over in those moments. So my script, and it's not a magic script, but I encourage all folks to kind of identify in these moments because hopefully they will come. If nobody brings up that you've microaggressed, that doesn't mean you haven't microaggressed. It means that nobody has trusted you enough to share with you that you harmed them. So I try to remind myself that it really is a gift when somebody trusted me enough to say, I know Naomi will want to know and she's going to want to do better. And so reminding myself of what it took for someone, because as we've talked about already, in most cases, folks who experience microaggressions again and again and again are not going to raise it because they don't want to be harmed even more. So it does take a huge amount of trust for them to bring it up to a person. And that's where my script starts. I like to say, thank you so much for trusting me to share this with me. I then like to apologize for harming someone, intended or not. And then I say, I commit to learning from this and doing better in the future. I won't do this again. So thank you for sharing it with me. And that's where I leave it. And I think people should put those sorts of scripts into their own words, but have a script because with microaggressions, particularly for folks who are really just starting to understand and explore them, we just have a tendency to say I didn't mean it like that instead of I'm sorry. Like it's fascinating to me how quickly we get defensive. I see it all the time. I didn't mean it like that. I think they're just being overly they misunderstood what I was saying. Um, and again, as I've mentioned a couple of times, what that is doing is it's centering ourselves and our intentions over the harm and experience that someone trusted us enough to share with us. So I love to start with the thank you for trusting me, and to acknowledging that. And when I say those words, it then brings my defensiveness down. Like as soon as I say thank you so much for trusting me to share this with me, um, I remember like, oh, I do. I am very thankful. Like that did take a lot, and I had to start saying the words to remind myself of what I know is true. And so I am a big fan of those scripts and thinking through how we want to say things before we are in situations where we need to say them.
Mm. Yes, as somebody who does spends a lot of time coaching communication, I love
Mm,
the idea of having a script and not to make things cookbook like, but just to give people a framework for where to start because it can feel very overwhelming. And I think we are so uncomfortable with, and I say we as veterinary professionals are so uncomfortable feeling like we did something wrong. I think we
yeah.
tend to be a very shame-prone group of individuals that really
Mm,
pride
mm,
ourselves on helping and being caring and compassionate. And so when
yeah.
we hear about something we did, it's hard to separate the behavior from our sense of identity or our
Yeah.
personhood. And so
Yeah.
that shame experience is so uncomfortable that we immediately default to, but that's not what I meant. And so,
Mm-hmm.
yeah, I love
Mm-hmm.
the idea of having that script to pull yourself out of it and obviously
Mm-hmm.
stating in a way that feels comfortable for you. And I'm thinking back to situations where I had colleagues and friends bring microaggressions that I had committed or
Mm,
evoked to my attention, and almost having like the breath taken away from me and then pausing.
yeah.
And I don't even think I recognized it in the moment, that gratitude for, wow, they felt safe enough to say that to me.
Yeah.
But
Yeah.
really, I'm so glad they told me because I do not want to do this again. And
Yeah.
I'm so glad that they were the one to highlight that, or that I found out in this way and not some other way.
Yeah.
Um, you write a lot, Naomi, about the fact that education about microaggressions needs to go beyond simply learning the definitions and should include the practices of self-reflection, contextual understanding, and really harnessing these opportunities to learn what really are new communication skills.
Mm-hmm.
I'm wondering for veterinary professionals who are listening and thinking, I see this in myself, I want to do better. Where do I start? What are
Mm.
some practical strategies or steps that they could take from you and put into place wherever they work or wherever they live?
Yeah. No, I love this, and I think it's particularly neat to think about the work we do within the veterinary profession because built into the profession is continuing education. It's part of your oath. You commit to continuing education when you become veterinarians, and I love that part of it. I always joke that I'm sad that PhDs are never asked to do an oath. I'm just like, we should also be doing an oath. But it's maybe because we don't have enough power as PhDs. But I love that that's baked into the way that you do things and the way that the profession works. And I think making this a part of your educational journey and your continuing education is important. Like reading these articles, and thinking about how do I apply them. The other thing I was thinking about is in many of these articles, particularly on microaggressions, but any number of topics, relating to dismantling systems of oppression out there and in here. Um, I think reading those things can help us process some of the emotions and defensiveness that we have while we're reading those things. So we're not doing it in real time with people that we could potentially harm. So having that space to kind of do that reading, sit with those concepts, sometimes I experience like internal struggles in those moments as I'm reading. And I'm like, gosh, I'm glad I'm doing this while I'm reading and I can go look at more literature and not doing this with somebody who could be harmed or expecting them to take responsibility for my education. That's another thing that we can kind of fall into when we microaggress against somebody is we're like, oh, could you teach me about this? It's not somewhat when we have harmed somebody, it's not their responsibility to educate us. So we really want to be careful. If they want to give us a couple of tips, like welcome it, but we should not be placing the responsibility for our education on people that we have harmed or could harm. So that's an important way to do it. Another thing that I recommend and I try to practice myself is working to suspend judgment. And this is something it's multi-part. To be able to suspend judgment, we have to really understand ourselves. We have to practice self-reflexivity, understand our cultural starting points, and then understand those starting points as one of many. Not the best, not better than, not worse than, but one of many that we can't assume everybody is following the same unspoken rules or cultural norms that in our head we're like, this is normal. We should just all do this. I think everybody agrees. That's not true. So, working to think, okay, I know where I'm standing, and that's one perspective, and it's not better or worse. How do I, when I'm meeting somebody, suspend judgment, recognize what assumptions I'm making about that person, and holding them and not assuming they're true, saying like, well, I made that up and it might be true, but it may not be true. So how do I kind of suspend judgment to really understand what someone's saying and sharing with me? And then the last thing that I think is particularly important, and we touched on this earlier, is because veterinarians are so busy and are making split decisions, it's not realistic to be like, well, you all should be reflecting on what you say in that moment. There's no time to do that. We all know it. But when are you setting aside time to think about how did my interactions go today? How did I show up with my team? How did I show up for my clients? Where were those experiences that something just didn't feel right? I don't know what was going on there. And reflecting on what did I say in those moments? Is that what I wished I'd said? And as you've probably already gotten a sense of, I do love scripting things. I do it myself. I think, okay, I said this and that didn't feel good. I'm not quite sure how it landed with that other person if they didn't tell me. But that's not how I wanted to show up in that moment. Let me re-envision what that moment would have looked like if I'd shown up the way I wanted to. And just kind of re-envisioning that helps us the next time because we won't be in that exact same situation with that exact same person, probably, but we're going to be in that situation again. So often, I see in our hospital and with a lot of practices that I work with or chat with, every time something happens, it's like the first time it ever happened. I'm like, yeah, this happened yesterday. I'm like, it is not a new thing, even for here. So making sure we're, you know, learning from our mistakes, learning from what we did so that we can be thinking about how do we want to do it differently next time.
I love that. So, what I'm hearing you say is this notion of almost a personal debrief, right? Looking back at our day and processing not just the cases, but also the interactions. What went well? What didn't
Mhm.
go well? What could I do better? And
Mhm.
using a strategy, which I often talk to individuals about in the well-being space, which is that mental rehearsal, right? When you
Mhm.
feel anxious about going into a surgery or having a conversation with somebody, when you know they're unhappy with you, going
Mm.
through it in your mind and thinking about what you would like to
Right.
say, what they might say in response, and then how you would follow through with that. So almost like a practice run inside of your head. I definitely cannot state enough the importance of knowledge and reading. And one of the best books I have ever read is So You Want to Talk About Race. And it just opened up my eyes so much to just all the things that had never been within my awareness when it comes to oppression and systems of oppression and unconscious biases. It was transformative for me. And you're absolutely right that it's hard to process all of that in real time. If you're really going to lean into this heavily, it requires a lot of self-reflection. And so
Mhm.
reading and giving yourself the opportunity to integrate, to to consider, to think
Yeah.
back. I think it's just so very important. So I agree with you wholeheartedly on that.
Right.
You are doing such important work in the veterinary space. And of course, you've been in many different spaces working to create a more inclusive and compassionate profession. If listeners would like to learn more about your research, your work at Colorado State University, or connect with you, where is the best place for them to go?
Yeah, I all of my publications are on Google Scholar, so I have a site that you can find all of those previous and then more in the veterinary space later in my tenure. I'm also on LinkedIn, always happy to be connected with folks through LinkedIn. And also I'm at we can share my email, but I'm always happy to talk with colleagues if questions come up or you just want to connect. I
Mhm.
always welcome folks reaching out to me at Colorado State as well.
I love that.
So yeah,
Awesome. Well, thank you. Well, we will definitely link up to your papers and your contact information in our show notes as well. We'll close with the same question that I ask all of our guests on the podcast, and that is, what does the phrase reviving veterinary medicine mean to you?
yes, I love this and I love the title of your podcast as well. I was thinking about this and I think from my perspective, reviving veterinary medicine means expanding and access and enhancing access to care in all of the ways that we can think of, whether it's finding funding for folks who do not have that funding for veterinary care for their animals, and understanding microaggressions so that we're not breaking trust and limiting access for folks who might be experiencing harm in our practices, even though it's unintended. Um, Lastly, I'll just say that I think it's an exciting time from my perspective as a non-veterinarian looking at the veterinary field because I see more engagement and investment in the social side of veterinary medicine, which is relatively new in the field. And I think it's so important to be really, as you said, leaning into this, digging into this, understanding, conducting this research. And I do think that will go a long way to reviving or um, making vivid this profession of veterinary medicine.
I love that. Well, thank you so much, Naomi. I really appreciate your time and your expertise in our conversation today. And I think this is so important for us to be talking about in the vet med space. And I'm just happy to be able to share this with our listeners. So thank you.
You're welcome. Thank you for the conversation.